Namaste, I am Dr. Nischal, practicing as a consultant dermatologist at Nirmal Skin and Hair Clinic, Vijayanagar, Bangalore. Nummular eczema is a pattern of eczema. What is an eczema? Eczema is a condition where the skin becomes dry and it can scale off. That's called as a dry eczema, or it can be red, it can be oozing, it can be a weepy lesion. That's called as a wet eczema. In this particular pattern of eczema, the lesions are round and coin shaped. So that is why the name nummular eczema is given to this. So it's something, an eczema lesion which is round is called as a nummular eczema. What are the common causes for this? The most important thing is all eczemas are genetically predisposed. Sometimes it runs in family. So genetically predisposed means either there can be a family history of bronchial asthma, or they can have an allergic eye condition, or they can have a lot of sneezing or allergic rhinitis, or they can have a simple eczema in family. So whenever people are predisposed, this type of eczema can happen. Second common condition is the dryness of the skin. So the dryness of skin can be internal. Sometimes the sebaceous secretion is not so great and that gives rise to dryness. There are some medical conditions like ichthyosis where the skin is very dry, or it can be because of the external factors like the atmosphere climate. Usually in winters the skin becomes dry, so that can also precipitate eczema. Or when we are using wrong products for the skin, if we are very harsh with the skin, use of excessive hot water while taking bath, scrubbing hard, or using strong detergents to clean our skin can increase the dryness, and the dryness can lead to eczema. Rarely people can react to the products what they use on their skin. The fragrances and preservatives in the skin can trigger eczema reaction. So these are some common causes for eczema. Not only that, nutritional deficiencies with a lot of vitamin deficiencies, especially vitamin D, can alter the immunity and it can give rise to eczema. So on a whole, how do we control nummular eczema? The first and foremost thing is trying to keep the skin soft. Regular applying coconut oil before bath, using a lukewarm water while taking bath, and using mild body wash and applying liberally moisturizer immediately after bath helps to control the dryness of skin, and thereby it reduces eczema. Processed food contains a lot of preservatives, and people who are prone for eczema, sometimes when they eat these, the ready-made foods or the processed foods, that can increase the chances of nummular eczema. There are a lot of patients who just improve drastically the moment they reduce their processed food. So do pay attention to what you are eating, and that helps to control the eczema. And most importantly, try to cover the skin. Whenever the skin is exposed to a lot of air and dust and sun, the dryness is more, and that can increase your eczema. It will not allow the eczema to come under control. In spite of applying moisturizers, if the eczema is still persisting, probably it requires a topical steroid cream or a steroid sparing creams for some time, and that's best suggested by your dermatologist. So nummular eczema is not a very serious skin condition, but you can't leave it because it gives rise to horrible itching and the skin may not look good. Thank you.